Welcome to Dr. T's Wellness Emporium. I'm Dr. Brendan Troster, PhD in developmental psychology and licensed therapist. Today we're going to look at the idea of mental illness and what it is. So what if everything you've been told about mental illness is wrong? Not just incomplete information, but completely, totally, fundamentally mistaken. Thomas Szasz was a psychiatrist, an academic who really made some pretty big waves in 1974 when he published this book, The Myth of Mental Illness. And he said something that the field still struggles with today, and that was that mental illness is a myth. So in today's video, we're going to break down what he meant, why he might have been more right than most people are comfortable admitting. So what did Thomas Szasz actually say in his book, The Myth of Mental Illness? Well, he wasn't denying that people suffer. He wasn't saying that mental distress isn't real. He was saying the way we explain that distress as like if it were a biological disease that is fundamentally a category error, is what he was saying. To quote him directly, he said, quote, mental illness is not a literal disease like cancer or diabetes, but a metaphor for problems in living. So he was arguing that psychiatry medicalizes behaviors that society finds inconvenient. So psychiatry turns moral, relational, and existential struggles into disorders. And this is often done to justify control, confinement, and forced or involuntary treatment. So, what about biology, you might say? And that's the mainstream psychiatry pushback. They'll point to brain scans, neurotransmitters, and genetics. The problem is none of that proves anything. It doesn't prove anything at all. There's no biological test for depression, bipolar disorder, or schizophrenia. And no one, despite years and years of searching, no one has found a single gene or even a cluster of genes that causes all of these so-called disorders. And many people with a diagnosis show no biological abnormalities at all. And people with brain differences or even abnormalities often function just fine. And Thomas Insel, who was a former director of the National Institute of Mental Health, even admitted that billions were spent chasing after biomarkers, and they came up completely empty. And he said, quote, at the end of the day, we failed to help people get better, end quote. So let's be clear about this. The biological correlates are not biological causes, and correlation is not diagnosis. So what is the role of culture, family, society? We have many traits that are passed down to us that aren't genetic but could be categorized as relational. Okay, so anxiety, shame, avoidance, emotional cutoff are all things that are learned, taught, and modeled in our family system and the social groups that we interact with and society at large. Right, so what looks like mental illness may actually be what is called in family therapy the multi-generational family transmission process. Another way of saying it is the multi-generational transmission of emotional pain. So emotional pain that is transmitted throughout the generations, and then not just that pain, but also how that pain is dealt with, how it's processed, how you handle it. Those are things that are passed on. And we also can't ignore cultural and social context when it comes to mental disorders. So things like poverty, oppression, abuse, and even a spiritual crisis. So those are all things that aren't going to show up on a brain scan, but they break people down nonetheless. So when we reduce distress to faulty brain chemistry, we ignore the bigger picture and also the person inside of that picture. So why does this still matter? So Szasz was warning way back in 1974 that calling suffering an illness does more than distort the truth. It strips people of agency. People are told they'll have a chemical imbalance and that's going to last forever. And even though that's been thoroughly debunked, and modern psychiatry doesn't rest on that chemical imbalance myth anymore, many people still believe it. I still, when I ask people, well, what do you believe is the cause of your distress, I often will hear, I probably have a chemical imbalance or something like that. So people still strongly subscribe to that belief. The people are also led to believe in this process that their thoughts don't matter unless a doctor says that they do. And also that you should just comply with whatever you're told to do and not question it. So, involuntary hospitalization, over medication, expanding power of the DSM are all things that happen in the name of treatment. But what if the root issue isn't a broken brain? What if the root issue is that your life is broken, that the system itself is broken, or that you have a broken spirit? And also, let's look at Thomas Szasz also said that these involuntary hospitalizations and forced treatment were crimes against humanity. So, is mental illness a myth? Maybe not in the sense that suffering isn't real, but maybe the stories that we tell ourselves about that suffering, the labels we use, the treatments we impose, are the real myths. So if this video made you think, don't forget to like, subscribe, share it with someone who also likes to question the system, and go ahead and drop your thoughts in the comments. I'd love to hear from you.